Clients therefore had to seek health care at other polyclinics during that time. Consequently, the Ministry of Health and Wellness considered it prudent to effect refurbishment and retrofitting of the clinical areas and to expand this facility to ensure compliance with COVID-19 protocols simultaneously. No doubt, all of us are aware of the urgency of proper management of infectious disease cases while permitting routine management of non-infectious patients. As the Prime Minister always says, we have to learn how to walk and chew. Furthermore, as Minister of Health and Wellness, and given the mandate that the Prime Minister assigned to me almost 3 years ago, we are aware that the delivery of quality and affordable healthcare services to Barbadians is a task that cannot be postponed. It is a task that requires all of us, both in public and private sector, to work together if we are to fight and win the battle against the burden of diseases in this island. It is a task which we must use in the fight against COVID-19. It is our goal at the Ministry of Health and Wellness and the mandate given to me by the Prime Minister to improve efficiency and the performance of health systems to make healthcare more available, accessible, and affordable to our citizens and in their communities.
In 1953, a fledgling Barbados Labour Party government made a determination that community health care should be available to the people of this nation if we are going to turn back the awful illnesses, infections, and lack of access to basic health care that too many of our citizens were facing in the early 1950s. Many will recall that the journey towards development for ordinary people in this country meant first and foremost, do I have access to a job and food and nourishment? Do I have access to education? Do I have access to health care? Do I have access to housing?
On the main artery to the East Coast was a constant reminder of what appeared to be neglect and disinterest. And this constituency, it promised not to be long, but this constituency has been promised a new healthcare facility for quite some time. It was supposed to be at the Tamarind Hall facility. And when I broke ground for that facility in 2007, it was to my regret that we didn't have the finances available to do it then. And in the years since then, we'd heard that this clinic was going to be closed and that residents of St Joseph would have to go to Gall Hill to receive even the most basic of medical attention. And while as the crow flies, Gall Hill Polyclinic is probably no more than 1.5 miles away. That notion that St. Joseph residents could conveniently get to Gall Hill was completely misplaced, because they would have had to take a bus to town, and then take a bus to St. John, and then take a bus back to town and a bus to St. John if you wanted to get a dressing done. Minister Bostic faced, when he came on the tour with me, not just an unhappy member of Parliament, but I was mean enough to bring along some of my more vocal constituents. And as we walked through that shell of a building together, he and his team saw firsthand the pain and the shame on the faces of my constituents, some of whom, Prime Minister, have unfortunately died in the last few years and are not here today to see this beautiful gem that we now have.